Awesome. Hi, I am so glad that you're here. I've been looking forward to this for weeks. So welcome to the Fibromyalgia Podcast.
Thank you, Tami.
I want to start. I just read your bio, and I would like to start with just a couple of terms that not everybody might be familiar with. And we're going to be talking about some of these things a lot. So I would love for you to tell us, what is a naturopath? What's a naturopathic physician? And how is that different from a regular primary care MD that we go see?
Perfect. So naturopathy, a lot of it depends on where you go in the US and where you go in the world. So mostly people know about MDs and DOs as primary cares, but NDs do a lot of the same stuff. In fact, nowadays, if you go to an accredited school in the US and Canada, we have to undergo all the same training so that we can do primary care. That's because in certain states, we are licensed as primary care providers. Oregon's one of them. I think Washington's one. Arizona is definitely one. So we get all the same training in pharmaceuticals, minor surgery, diagnoses, how to read x-rays, all of that stuff. But we have a completely different approach for how we tackle health issues in the body. We like to stimulate your own healing capability. Just like your body can create inflammation and have these issues, we can help your body to rein it back in. And in areas like Oregon, where we can combine conventional medicine with those tricks, it's wonderful because medication has a place and natural things have a place.
Absolutely. And you are my primary care. I've said several times on the podcast that I feel like when I'm working with my clients, if they don't have a naturopath or a doctor who's trained in functional medicine, then it's kind of like they're just sort of treading water and trying to just kind of keep the boat afloat, but we're not necessarily making progress. And it wasn't until I started having doctors like you on my team that things really started to change for me, which takes me to the second term I would like to have you define for us, which is functional medicine. What is functional medicine? What does it mean to be trained in functional medicine? And how is that different?
Yeah, I think, and it's a hot term right now. It's funny. So I'll give you an example because when I think about, all right, how do I define functional medicine? When I went to my first IFM training, that's the Institute for Functional Medicine. It's pretty popular. I think it's ifm.org. When I went to my first training, the lead organizer, he came up and he's like, okay, this is going to sound bad, but I have to ask, you're an ND. I'm literally teaching MDs to be NDs. So why are you here at this conference? So for me, ever since then, I've just thought, okay, it's MDs being trained in doing more nutritional counseling, testing and replacement for nutritional deficiencies, getting at the root cause, and helping the body function better. There are a lot of different ways to describe it, but ever since that interaction and the training I've had with it, that's how it is in my head.
Yeah, absolutely. And the other word you just said, how the body is functioning, right? Like how we look at labs through a functional medicine lens, and probably the same with being a naturopath, is where is the body going to function best? Not, what's normal for the population, but really where do we function the best? So I think that word functional is a huge piece of it.
And that's true, right? So I forget about that because I'm so used to reviewing labs and looking for optimal ranges, not the standard ranges, that when people come and they're like, I hear you look at labs differently, it's like I pause for a minute because I'm like, well, doesn't everyone look at labs the same? But it's true, we don't.
Right.
It's all about optimal ranges and balance and seeing what's out of line.
Yep. I love it. I love it. So I mentioned this in the introduction, but I have to say it to you. And that is, when you and I first met, I thought I was doing really well. And of course, because, we were in the same networking group, my doctor had left the group. So I, of course, went to you, and I was shocked at how much better I could actually be. So first, thank you for that. If I haven't told you recently, but also I think it's a good I think it's a good example of how all of us can find ways to improve and just kind of keep improving little bit by little bit. And you just never know.
Yeah, and it's hard too, because when you live with chronic conditions, whatever they are, it always becomes the norm. So when you have some improvement, it's hard to see when you're in that space that you can improve further. So keeping that motivation, that desire to keep pursuing improvement, it's important.
It is.
It's hope.
Definitely. So one of the reasons we have you on here now today is because you are opening your own clinic. And I am so excited about this. So tell us about that.
Yes. Well, first off, please come back to town and see it.
I know. I will make a trip down. I'll come see you.
We opened officially on March 1st. So I have done primary care in Lake Oswego, Oregon for the last 10 years. And what I decided to do was open up a practice closer to home. Not going to lie, it is half the distance from my house. So it's wonderful. It's now in Tigard, Oregon. And the goal was to have a clinic with multiple types of medicine for integrative medicine. I have space for a chiropractor. I have been looking for a massage therapist. I like one-stop shopping. If I'm going to be honest, in my head, it's one-stop shopping. You can come here for your primary care needs, like your wellness visit, your gyne exam, your lisinopril refill. But at the same time, we do injection therapies for pain. We do B12 injections. We do IV nutrition. I like to have a variety in there. So yes, honestly, in my head, I call it the one-stop shop.
I love that. And I've been to a few clinics like that. My chiropractor, massage therapist, acupuncturist were all in the same clinic for a while. And it was awesome because I would just see them one right after the other. I called it spa day.
Oh, that's fantastic.
That's awesome. So how did you get into medicine? Why is this a passion of yours?
Yes, let's see. So I'm trying to think. So when I was small, it started for me when I was small because of my mother, gonna be honest. So thank you to her. She's benefited me very much in life. She's
and wonderful. Me, so thank you, Mom.
So I kind of say that in a funny way because the reason that I was surrounded by stuff is my mom was really not comfortable with doctors, standard medicine doctors. Oh, heck no. So when I was small, I had Tourette's syndrome. I guess technically still do, but it was more prominent. But there was no way she was going to take me and put me on any of the standard meds. So she started giving me supplements and had all these books. And there was always a manual, some kind of anatomy, something around. And so that's when I started reading all those books. And I was like, this is interesting. Some things got better, some got worse.
Right.
So that's when I got interested in it. And then I started working in hospitals as a physical therapy aide while I was in college. And then not long after that, I started having my own odd health symptoms. And I think all of that drove me toward this. My time spent in the standard hospital system, I did know that I wanted to do more than conventional medicine.
Mm-hmm. Yep, definitely. All of us, I think, have something in our personal history. I always ask that question because there's some reason that we do what we do. And so talking to you right now, the listener listening, if you're going to go out and you're going to find a doctor, a coach, a personal trainer, and anything, find one that is super passionate about what they do and loves to geek out on it, because that is this lady right here. That's one of the things that I appreciate most about you is seeing your face light up when you geek out on, the medicine that we're talking about. It makes me feel like I'm in good hands.
That's why it's fun. And honestly, that's why I did some of the functional medicine training, because I was like, oh, it's more. This is just like med school. It's awesome. It's enjoyable. And then, a lot of it too, if I'm being honest, is it's like feeling a level of security for my own health and the health of my loved ones, being able to have access to this information and the knowledge.
Mm-hmm, definitely. which is a great segue into how you go about, how you approach treating things like fibromyalgia. You're also a whiz at, autoimmune stuff and all of those undefinable, invisible, chronic, stuff. So what's your approach? How do you figure out where to go with clients?
Yep. So a lot of it depends on what stage they're coming to me, right? Like I have the people who've had symptoms for 10 years. Maybe they've been told that they have lupus. Maybe they've been told that they have fibro. Then I have other people where it's been a few months of new symptoms. Either way, my first approach is always to look at the basics, right? Are they sleeping? Do they have good energy? Do they have good thyroid function? Are their hormone levels normal? Do they have a history of infections like Lyme disease or Epstein-Barr virus? Like, do they have a history of mono? So I go digging for all those little pieces because with fibromyalgia and honestly, any autoimmune or autoinflammatory disorder, any of those chronic inflammatory conditions, you have to work on all the parts at once. You don't see a lot of improvement. If you're only working on gut issues, if you're only working on sleep, just one thing at a time, it's like treading water. You're not moving anywhere. So looking at all the different pieces, because one single thing may not fix how you're feeling and get you from A to B, but if you can get improvement in 3-4 different systems of the body, it makes a massive difference in quality of life.
Mm-hmm. Mm-hmm. And how do you balance that, needing to address enough things that we're making a dent with the idea of if we do too many things at once, how do we know what works?
Yep. So there is always that level where, no matter how many things you add, everyone's an individual, but everyone has a limit, right? For like, okay, I can only do this much. And then I completely lose track of what the heck we're doing. But what I like to often do is figure out a few main things that I think will most likely all create improvement, put them in. And then once you get to a certain level of improvement, take them out one at a time. You can take the approach of putting one thing in at a time, and then maybe that works, maybe it doesn't, you go on to the next thing. I would much rather get people feeling better up front, and then you can start taking them out so that you're not living on a million pills or taking a bunch of treatments forever.
Right, right. Now, I want to tell our audience here really quick. I did an episode a few times back about what does Tami do? And I actually listed out all the supplements that I take. And I said in that episode that I went to you and said, should I really be taking all of this stuff? And you said, if you're still feeling good, why change? Right? So yes, it's and that's been one of the things I really appreciate about you too, is that you really look at how people feel, not just how they look on paper.
Yeah.
Right.
I do, certainly. Yes.
Yeah.
Well, we're talking about these inflammatory conditions, and they're hard to identify. Sometimes they're hard to name, and you have to be able to kind of dig a little deeper and see, what people's limits are, what they're comfortable with, because it's not just like physical activity that'll wear people down. Having to think about self-care, having to manage all these different symptoms, it'll burn anyone out.
Absolutely. Absolutely.
So some people can handle 2 pills a day. Some people can handle 10 bottles of pill a day.
and that people's name is Tami. It's true though. I mean, I have some clients that, I happen to be a person that like pills are easy. Like I could do that all day long. Give me however many, capsules or whatever you want me to take. And it's easy, but I have other clients that just can't choke them down or, psychologically don't like that. And so that's okay. We just find other things that work for them. So.
Like IV therapy.
Yes. Let's talk about that a little bit. People might not be familiar with, IVs for anything other than, I'm in the hospital and need something.
Yep. Okay, so there is just basic IV hydration, right? It's a saline drip bag. You can get it at a whole lot of clinics. And I would not underestimate how helpful that can be. So for people with lower adrenal function who don't hold on to fluids as well, and they have low blood pressure, get dizzy, getting some bags of IV saline can feel amazing. But if you start to add some vitamins to that, it's even better. So when you're getting an IV with different vitamins, minerals, you bypass absorption issues in the stomach and in the intestine. And as we all know, inflammation, most conditions, they start in the gut. So you can't always trust that you don't have permeability and that you're going to absorb everything well. When we do the IV, it bypasses it. So it's a really sudden big boost of vitamin and mineral support. So sometimes we're just replenishing someone. It can help a lot with energy. Other times we do targeted IV therapy. If I had to choose a favorite, it would be glutathione infusions. Glutathione is the body's major antioxidant. I love it so much. And it's really good for body pain, fatigue, inflammation in general. I do it a lot for fibromyalgia, chronic fatigue, rheumatoid arthritis, and in these things called paresthesias, so like tingling, numbness, things that aren't responding to like B vitamin shots and other things. Glutathione's the best. If you haven't heard of it, look it up.
We will actually I'll make sure that we spell that out in today's show notes.
Amazing.
So
favorite thing ever.
That's right. So everybody just go to fibromyalgiapodcast.com/77. That will be today's show. We'll have the video of this interview as well as I'll spell out glutathione for you. What are some other things that you, IV or otherwise, what are some other things that you do with your fibromyalgia and chronic pain patients?
Yeah. So oh goodness, in 2012, I started doing medical ozone therapy. So I got trained, and when we hear ozone, we think of pollution in the sky.
Ozone layer, right?
It's a problem. You don't want to breathe in ozone. But ozone as a medical therapeutic has been used for over 100 years. It is sometimes done as an IV therapy where a bit of blood is taken out. The blood is ozonated. We have a generator that uses medical grade oxygen. And then when the ozone hits the blood, it stimulates some of your own antioxidant pathways out of your blood cells because the ozone is oxidative, right? So it's this mild oxidative stress triggers your own system to produce more antioxidants. And it also separates out into a bunch of oxygen. So you see the blood turn bright red. So it's a nice little oxygen boost too, because then we return the blood to you. So that's one way ozone therapy is done. And that is good for overall inflammation, pain, like so if someone has pain in multiple joints or their skin, fibro, it's very helpful. When there's areas specifically that I want to target for pain, you can actually do something called prolozone. It's ozone injections, and it's very good for reducing pain. It's an analgesic, and sometimes people have pain relief the day of, but the goal is to have long-lasting pain relief.
So would that be similar to like getting a cortisone shot or something like that?
Yeah. That is a very good question. Really good comparison. So first off, cortisone shots hurt more. That's what everyone says across the board. I do administer cortisone shots at times if they're needed, but the number of those that you can do is limited. So for example, we generally don't like to ever do more than 3 for a joint because it does speed up breakdown and degeneration in that joint. So the difference between that and things like prolozone or PRP, which is another type of therapeutic injection, is that those can all reduce pain and they stimulate growth factors to help with healing tissue. Whereas steroids cut down on the inflammation, but they also stop that healing process.
Yeah, that's a pretty big difference.
Yep.
Yeah. Okay.
Sometimes you have to calm the area down with some, like if it's really acutely inflamed, like a shoulder or something like that, calm it down, and then you wait a month or 2, and then you're able to start those therapies. So
cool.
Mix and match.
Right. Definitely. What other goodies do you use? I'm just going to keep asking you that question. I'm going to dig them all out.
You mean other than glutathione? Also be an intramuscular injection and an oral supplement. Let's see here. I mentioned PRP. I love that. That is platelet-rich plasma therapy. And that is especially good for stimulating growth factors. So we actually take your own blood, so we don't have to worry about allergy. And then we do a special spinning down of it in something called a centrifuge, so that we can then separate out your platelets and activate them with calcium, with ozone. And by activating them, I really mean just irritating them, and then they release a whole bunch of growth factors. And then we inject that back into your own body in the area where we want to stimulate healing and control inflammation, et cetera. So PRP is so much fun. I love complex visits. So my favorite thing, I do all these different modalities like IVs and injections, but my absolute favorite is actually those people who have had all these undifferentiated symptoms. They don't have a clear name for what they have. I love digging into that. It's my absolute mission to find a name, or at least get to what's been triggering it all. And sometimes we get there, sometimes we don't. That's my favorite. That's what I want every day.
Right. The puzzle to solve, or the mystery to, figure out. Yeah, it's awesome. And I think that is so helpful for people like us, because we may be diagnosed with fibromyalgia, but it's usually not just that.
Yeah,
right?
Like there's just fibromyalgia.
Right. So what are some of the other things that you see often in your clients that maybe get missed?
Yeah, very commonly an autoimmune diagnosis. So a fair amount of my patients who have a fibromyalgia diagnosis also have Hashimoto's thyroiditis, or they have rheumatoid arthritis. Sometimes very often they have an inflammatory bowel disease. I'd say more often than not, it's not just IBS. So that needs to be caught. And then nutritional deficiencies. Usually if it's kind of the first time they've seen a naturopath or a functional med doctor, they're walking around with a very significant vitamin D deficiency. So inflammation is poorly controlled. Or they're walking around with low B12, which causes numbness, tingling, can definitely enhance any neuropathy, nerve pain that they're having. So those all need to be tackled. And then chronic low-level infections. And those trigger that recurring inflammation, right? So when you have fibromyalgia and you're constantly inflamed, it actually slows down your body's energy production. It kind of tells your cells to back up, move a little more slowly. So you're actually not as good at fighting off infections. That can be a chronic bacterial infection, sometimes a fungal infection in the sinuses. It can be chronic fungal rashes on the skin. It can be a lot of recurring outbreaks of herpes virus, cold sores, or Epstein-Barr symptoms. And so those make a huge difference if you can tackle them and get them under control.
Mm-hmm, definitely. Now, I know the person listening right now is thinking, that doesn't sound anything like my doctor appointments.
You never know. Maybe.
I would bet good money that most people listening have not had a doctor that's checked into all that stuff. So what would like a first visit with you, somebody finds your new clinic, makes an appointment. What does that first appointment look like?
Yep. So I spend an hour with my patients for the first appointment. But the big thing is going through every single system, because a lot of the time people have symptoms that they don't even think about that are really significant and important to telling the whole story. You know, if you're walking around in chronic pain, dizziness, fatigue, if you're having all of these systemic symptoms, maybe you also have ankle pain, that may not even be something you bring up. You're used to going to a doctor's visit that's like, what a new patient visit maybe is 30 minutes, maybe less sometimes. You know, you're going to list off your 1, 2, maybe 3 things you can get out. But the truth is we need to know, where does your body hurt? How much does it hurt? Do you have brain fog? Do you have trouble concentrating? Do you have anxiety or depression? What is your digestion like? Do you get skin rashes? Do you get hives? Gosh, a lot of people with fibromyalgia actually have mast cell dysfunction disorders, histamine intolerance, all of that. So rashes, hair loss, changes in their nails, blurry vision, dry eyes, which can actually be inflammation in the lacrimal glands. All of those things. So I go through all those different body systems, we'll call them that, I also love to review medications and supplements right away. And part of getting to know people, like we were talking about earlier with how much they can handle, I always look at their list. And if it's a long one, I ask them, is this comfortable? Does this work for you? And if not, we chop it down and get a lot of those things out of there and just utilize the ones we need the most.
Awesome. And what does a follow-up appointment look like? Like a regular, okay, now somebody's been established with you as a patient. What does like we would go to our primary care and it would be what, 6 minutes, 12 minutes?
It's been so long since I've been to one. Okay, so I'm being honest. All right, so let me see here. So usually at the end of that first appointment, I have a few treatment ideas in mind, but I also pretty commonly I'm ordering additional labs, right? Sometimes there's something that needs to be done, but usually there's some specialty autoimmune panels that you can order, or I want to see, I want to dive a lot more deeply into thyroid, for example. So most often at a follow-up, at least the first follow-up, we are reviewing labs, seeing what we can tackle. I'll usually send them some notes on that and what's changed even before the follow-up, because I'm impatient, so I don't want them to wait.
Right.
We'll review, did they try a glutathione push, my favorite, and did they feel any better? We schedule follow-ups for 30 minutes, and that is 30 minutes of face-to-face time together in the room. Sometimes we couple it with injections for pain or an IV infusion, but it's 30 minutes face-to-face.
Yes. So if you're listening and you're thinking, my doctor doesn't have time for me, first, if you're in Portland, go see this lady. We will have the link to her clinic on today's show notes. Just go to fibromyalgiapodcast.com/77 for today's show notes. And we should actually probably give them the name of your clinic.
Yes, it is. Thank you so much. It is called Framework Integrative Medicine.
I love that name.
Thank you. So do I, because I picked it. Bias.
Yeah, it's good though. I mean, knowing you, as long as I've known you, it's such a good name for what you do, right? Like you have to have a good framework if you're going to build a house or like do anything. Like it's the core.
All at once. You can't just build the roof and not have the foundation. You have to do it all. Yeah.
Yes, I love that.
Seems like a lot at first, but you chip away at it, it's very doable.
Yes. One of the other things I've seen you do with me and with other clients of mine that have seen you is that you're really good at helping people if they're overwhelmed, either by volume of stuff to do or by cost of things to do, at helping people kind of narrow that down to what's like most important and where to start. How do you make those decisions?
Yeah, so I really like prioritizing things and I like optimizing. So it's whatever I think you'll get the most bang for your buck on. For example, as an example, there are a lot of different ways to support adrenal glands, right? And we all know that if you've lived in chronic pain, had chronic inflammation, your adrenal glands don't put out a nice, gorgeous flow of cortisol all the time. They tend to go on the low end of normal. So you can take a whole bunch of different hormones. You can take pregnenolone as a supplement. You can take adrenal glandular, a bunch of herbs. And then you can also get like a fancy compounded bioidentical cortisol. That's all wonderful. It's beautiful. It's going to be tons of bottles and definitely not cheap. A really good example of an alternative is hydrocortisone through the standard pharmacy. It is bioidentical to your cortisol. It is cheap as dirt and it's effective. So there are a lot of different ways to approach it. It's hard for people when the only solution is $150 IV or a compounded cream for $75 to $150, right? There's so many ways to do things in a reasonable manner.
Mm-hmm. Yeah. And the thing she just mentioned there, that hydrocortisone, that was probably the thing that surprised me most when I started seeing you, that made a big difference for me. Something that I was on for a few years and now only need as necessary, but that was a massive game changer.
that's all about the whole building the right framework, right? Because when I was saying you have to make sure, okay, are there deficiencies? Are the hormones out of balance? Any of that, we don't function without healthy adrenal hormones, right? If someone has Addison's and their adrenals are actually shutting down, it'll kill them if it's not treated. So the whole idea of functional medicine, this is a good place to wrap that in, is all right, so let's say you have a range of daily normal output of cortisol. For a lot of us walking around with chronic pain issues, we're on the lower end of that. If we give a little bit of hydrocortisone, it doesn't go up over the range and give you the same risks as like doses of prednisone, for example, or cortisone shots. What it does is it brings you into a more optimized range, more of a functional approach.
Right. And if I remember correctly too, hydrocortisone is metabolized a little bit differently in the body than something like prednisone. Isn't it like processed a little different?
Yeah, because it is exactly bioidentical to your own cortisol.
Yeah. Yeah. And so taking something like that would be like, I don't know, taking thyroid hormones or taking hormone replacement for menopause or something like that, right?
Yep. Too much can cause problems. Not having enough can cause problems. You want to find that happy functional middle.
Definitely. Yep. Definitely. So for the people who are out there listening and thinking, oh, but you don't know me. You don't know all my problems. What would you say to them?
Yeah. Well, you know a lot about me, Tami, on this level.
Yeah.
So I definitely know what it is to be in chronic pain and to be incapacitated, honestly, by it. And I also know what it's like to not have a clear name. So years ago, I started having some whisperings of things in my early 20s. I had what seemed like potentially Crohn's, refused to go to a doctor because I was raised not going to them too often.
Yep.
And then I started getting joint pain. And that was my first time noticing, like I was 20, I think 21, and I had pretty crippling pain in most of the joints in my hand. Around that time, I went off gluten and it went away. The gut symptoms also got much better. So that was probably my first exposure with pain and odd inflammatory symptoms. But the big change was in my late 20s. I didn't want to be a hippie naturopath, and I was living mold while I was in med school. And granted, I should know that black mold climbing up the walls in a fruiting body the size of a baseball coming up under the floor are probably toxic exposures. But mold is such a catchy, like a difficult topic. You know, some people are like, oh, mold's fine. And then other people are like, mold ruined my life. It did try to ruin my life. So I was
Now, just to clarify, there's mold and then there's mold, though, right?
There's mold and then there's mold. Yes.
Yeah.
There's botrytis, and then there's like a little bit of penicillium. Like yes, and people can have allergic reactions, rashes, asthma reactions to all types of mold. Some of them are very toxic and do kill people. So I had some of the more toxic types in the little apartment I was living in. And I was in denial, so I stayed in it for 2 years.
Oh, Lord.
Within the first few months, I developed asthma for the first time in my life. I started losing hair. I completely lost my periods. No hormone symptoms. My thyroid numbers completely dropped off into the red. I was in medical school. I was working closely with the doctor, shadowing him, so I had an opportunity to get all these labs done. It was horrible. And then my husband moved in, and he was bleeding from his sinuses for all 6 months that he was there, just nonstop blood. So even he couldn't resist the mold issues. But the other big thing too was I did develop chronic abdominal pain. It was in my kitchen, the mold was as well. And it's been diagnosed now as just chronic visceral pain syndrome. But it's daily, it's relentless, and I'm 11 years in. And so I have accepted it. Took years, but I've accepted it as part of me now. But I've found a lot of ways to live around it, fixing my thyroid, getting my hormones back up and running. All of those little things didn't fix the pain, but it made it better. And then Later, that triggered some other things. So some what looked like some undifferentiated autoimmune with swelling in my joints, and I have erythromelalgia, which is neuropathy. So different ways that the inflammation has shown itself, but I have the right tools to treat it and control it. So my quality of life is very good.
And that's the important thing, right? It's not whether or not you have that diagnosis written in your chart. It's, are you able to live the life that you want to live?
Yep. And
Right?
I am. And it's fun too, because I now have the energy to help other people. And I also have really bad days. And so I get it when they come in and it's just, it's not a good day and it's hard to add anything new.
Mm-hmm. Definitely.
I
You
understand
guys.
on a level that I never would have.
Exactly. Exactly. It's I think that's one of the things that as coaches we really offer our clients and doctors like you who have that experience yourself, right? Is that so many people we talk to try to understand but can't really unless you've actually like walked in those shoes, lived in that kind of a body, right? And so it can make such a difference talking to somebody who really gets you.
Yeah,
Yeah.
I agree.
Awesome. Any last thoughts, words, advice? Think about the woman who's listening to this who is frustrated, not getting the help that she needs. Talk
Yeah.
to her.
Don't be shy about hunting doctors. Those of you listening, you've probably already done it. Uh, the ones who maybe you're on your first doctor, maybe your second, it's okay to have a team of doctors. It's okay to say this person's not a fit for me and keep looking. The one big thing I would shy away from with any provider is if they don't like you working with 2 other doctors, 3 other doctors, get rid of them, because you need a team and it's okay to have a team. You want someone who's willing to cooperate with your needs and with the other providers that are helping to take care of you. And don't feel shy about researching. I have so many patients who come in and they're like, I know I shouldn't do this. I Googled. No, you know your body the best. And even though Google will probably tell you that everything is cancer, you doing your own research digging is how you're going to find explanations to things or ideas to pursue. And those ideas help your doctor too. So don't hesitate. Do your own research, know the labs that you want, find a doctor who will order the labs that you want and tell you the additional ones you weren't able to find via Google.
Right, exactly. It should be a collaboration.
Yep.
Right? Yeah.
We're here to serve you. You're not supposed to come in and make us happy by following your one plan and then go home. We are here to serve you.
Absolutely. Oh gosh, that just brought up a bunch of other questions for me. Do you have time for a couple more? Okay. So the first question was, oh God, how do we, one of the things I see so often, let me just start over. One of the things that I see so often is that there's this sort of medical PTSD in chronic pain, chronic illness patients. And so do you have any advice for that person who is tried a bunch of doctors, going to try another one, is afraid of being seen as drug seeking? I mean, we're going in with chronic pain, right? We know we just want to feel better. It's not about the drugs. But, you know, for the person who is afraid of that, do you have any thoughts or suggestions on how to approach that in a way that gets their point across without? Yeah.
Yeah. You know, that's a tricky one, because someone could even write that out beautifully in a message to the doctor. And if it's the wrong doctor on the receiving end, it's probably going to be like the experiences they had before. I guess my advice in that situation, other than don't give up hope, but my advice in that situation is don't go in blind. Join local Facebook groups with, that are related to fibromyalgia and care, network with your friends. What you want to do is find a doctor that you have friends and peers who've gone to, and they know firsthand that that doctor understands the situation and your needs, because that person is going to know when you walk in the door that you are overwhelmed and that you've been dealing with a diagnosis that has been probably impossible to chase down, and that you've had horrible experiences with other physicians. I expect that if someone walks in and they've had a diagnosis of fibro and only ever seen one doctor, I'm in shock. I had one recently. I was completely in shock. Now, granted, I hadn't tried anything really except like Lyrica and Tramadol, but she'd only been to one doctor and she'd been diagnosed over 2 years ago. So if it's someone experienced and you know from a friend or a peer that they're high quality, you don't need to go in with the same hesitation.
Yep. I agree. And this is actually something that we as coaches often help our clients with is finding new doctors, right? Because we've got a network of people all over the world we can ask. And we also I've been doing this for a really long time now. And I can look at doctors' websites and have a really good idea of, is this somebody who's just giving the F word some lip service, right? Mentions fibromyalgia, but doesn't really know anything. Or if it's somebody who can really help.
Yep.
So,
well,
yeah.
See, everybody needs a Tami coach.
That's right.
So if I could, I would duplicate you.
I know. I would duplicate me too, which is what I'm trying to do, training new coaches. So
quickly.
Yes. So then my second question that I wanted to ask you, that your previous comment brought up for me, was that research and knowing all you can as a patient. What are some of your favorite resources for people learning?
Well, your podcast is one of them, for what it's worth, for my fibro.
Good.
Yeah. So you do want to be careful about sources, right? If you can get your hands on a good medical text, a good book about fibromyalgia, fantastic. Nowadays, we're honestly all doing it online. What I recommend is searching for things through PubMed. You can see when it's large studies with numerous providers that took part. You can see where it's just kind of an opinion piece. But if you're just looking at random websites, there's no way to depend on the quality of anything you're getting. So a really simple trick for that is to, log into your web browser and you can just type PubMed and then write fibromyalgia and magnesium, or PubMed swollen ankles and red skin. It's erythromelalgia. Or you can also just put NIH and then write those in. So that's honestly my trick, my quickest way to just get to those research articles. Mm-hmm. And then also finding contacts and links through, your local naturopath or functional med doc, or going to ifm.org and using some of the links and stuff they have on there, because their materials are good. Their sources are good.
Right. I think it's important to, if you're doing that random Google search and you find something like, all you need is apple cider vinegar to cure your fibromyalgia, take that information, go to some place like PubMed, or Google Scholar is another good place to look up studies.
I'll back up on that and say, if you see the word cure, move on.
Yeah.
I've had patients who are asymptomatic. They've gotten to the point where they have no pain. They feel back to their normal selves. But we all know, what if something stressful happens? What if they get in a car accident? They could come out of remission. So the word cure means someone doesn't get what fibromyalgia is.
Right. And you are the one who rocked my world the day you said you consider me to be in remission. I don't know if you remember this, but we were in the middle of appointment. We were talking about something completely different. I don't know, my thyroid labs or something. And you made this comment and you just moved on. And I sat there like, what just happened?
True. That's right. I remember we discussed it later, because for me, well, good game face, first of all. I mean, it's true. When I think of goals for my patients with fibro, it's Tami's face. That's literally you. And so, yes, in my head, you had already been in remission for years and you knew this.
So I think it would be really good for you, as the doctor who told me that, to define what that actually means.
Yep.
Right.
Yes. So essentially remission, right? No longer living in chronic daily pain, feeling like you have the energy to get through your day. Maybe not amazing energy, like, oh, look at me, I'm going to run this marathon, but not to that point where you're like, can I shower today? Am I able to cook, or do I just have to get takeout again? Actually being able to get through your day, and not having constant pain. And for some people, there's other things, right? Maybe it is joint swelling, maybe it's digestive symptoms and insomnia. When those are back to not perfection, but more of kind of what you're used to earlier on in life, that's when you're there.
Mm-hmm. And I also think the length of time matters, because fibromyalgia is this sort of cyclical illness, right? Like we have good days, we have bad days. So when you're having good days, that doesn't necessarily mean you're in remission when next week you're going to have a bad day.
No, that's for you. It had been well over a year, right? It had been several years.
Yeah.
No question. Yeah, I mean, I wouldn't even say 6 months. I would say 12 months, because what I say to my patients when they come in, it's our first time meeting, is I'll usually be honest with them about expectations and how long I think it's going to take to see improvement. And it's usually about 12 months. I tell them, expect this to be a year process to get to a new baseline of function. So I would say at least a year of basically having no symptoms to reach Tami level remission.
Tami level. That's like the new up leveling in your game. This is the Tami level.
Life, and then you hit Tami level.
That's right. That's right. Oh, I love it. So I just want to mention here really quick, and I want to mention it with you on, because I know you'll have something to say about this. But I am starting a new round of our Certified Fibromyalgia Advisor program at the end of March. So in just a couple of weeks from when this comes out, it's a great opportunity to learn all that you can learn in 9 weeks, all I can teach you in 9 weeks about fibromyalgia. And so if you're one of those people who loves to do their research and really wants to learn all you can and be empowered when you go into those doctor's appointments, it's a great opportunity.
Let me jump in here. Please, anyone listening that would like to do this, please do this. And it's a selfish request. It's a selfish request. My patients who have a fibro coach, they do so much better because they have someone who's experienced with it, who can also day to day be like, you know what, you're having a rough day, skip that part, or, even just as simple as saying, time to get a new doctor. Like, having a coach to guide you through it is amazing. And while I try to be available to answer the questions my patients have, like, changes to supplements or maybe considering a new diet, having a coach who's experienced along the way to also answer your questions on a daily basis is huge. I can give the tools, they will help you implement them.
Exactly right. That's my favorite thing, talking to our clients, be like, okay, what'd your doctor tell you to do? Okay, now let's figure out how you're actually going to do it.
Yeah. How do we make that square fit into the hole?
Yep, exactly. Awesome. Well, thank you again so much for being here. This was so much fun. We could talk for hours about so many things. Oh, I should have you come back. We should talk about mast cell. We should talk about thyroid stuff. We should talk about all kinds of things.
Thyroid for an hour.
Yes.
I would love that, actually.
Yeah.
I miss you.
I miss you too. So give us the info on your clinic again. And just to remind everybody, this will also be in today's show notes, but
yeah. Oh, I have an update. I just thought of that. I am now dual licensed in Oregon and Washington.
Oh, nice.
I forgot to tell you.
And you even do televisits, right? Yeah. Once somebody is established with you as a patient.
Yeah, it depends, right? It has to, depending on where they are, which state. If they're out of state, it has to be more like a consulting thing. But for Washington, not an issue.
Oh, one more thing, everyone. Kaley and I have been tossing around this idea of doing a joint retreat where you get all of her goodness and all of my goodness. And so if any of you think that sounds awesome, I would love to hear from you, because we've been talking about it. We started talking about it before, of course, the world shut down, and that kind of put an end to our discussion for a little while. But if enough people are interested, that might be something we have to do.
The time is coming for more comfortable travel and warm areas.
Yes.
Because we're in the Southwest and we're colder.
Yeah. It sounds like you're advocating we do this not in Portland.
exactly what I'm advocating. Did you pick up on that? Yes, please.
Caribbean somewhere, right? All right. Well, let's go ahead and wrap this up. And thank you again so much for being here. Everybody go to fibromyalgiapodcast.com/77. If you're in Portland, please go see Dr. B. I wish all of my patients could see her. She is amazing. I love you.
I love you too. Thank you, Tami.
Yes.